Do you ever wish you could just like hit the reset button on something? It's like, start over. So this is something that we talk about in PT a lot because at the heart of everything is our nervous system. And our nervous system is, and we usually think like, oh, our brain and our nerves, like, yeah, I get it. Like it's all like, you know, and I get it. If I want to move my arm, my brain tells my nerve to then tell my muscle to move. And it's like, yeah, there's that. But there's also the part of our nervous system that's really sensitive to pain, to any like thoughts or fears in our head. And all those can kind of cause our nervous system to kind of guard and protect. Even if it's something that we're not even like aware of. Like maybe there's something that's, you know, causing me to kind of hold this shoulder like this for no good reason. And then it gets all kind of cranky. So we like to try to figure out what's going on. And we follow this system through the functional movement systems, and they have this whole system called the Selective Functional Movement Assessment. Their treatment paradigm is essentially reset, reinforce, and reload. It's really cool. That spoke to me. And what we mean by that is like, well, if we have pain or we have like some muscle tightness or we have a joint that's not moving, if we do something that kind of gets the nervous system hit the reset button, everything kind of goes, and then you're like, cool, if it doesn't hurt, now we can use it better. And now we can start to make like lasting changes. If your whole system is like even your external system, like your muscular system is guarded, and maybe internally your nervous system's like just holding on for dear life, there's no way we're gonna make any changes. It can poke on things, it can make it feel better for 30 seconds, like that's cool, but that's not really what we're about. And I'd much rather try to see if I can hit the reset button, get your body to relax out for a second and stop holding, and then it'll be more receptive to some sort of change that we're trying to incur. Then we're gonna try to teach your body something, which is really what a corrective exercise should do. So if we hit that reset button, now we have a blank canvas. Now let's reload kind of from the ground up, or from like super simple to complex, and you know, remind your body what normal feels like. Does that make sense? You know, if you get a massage or maybe go to chiropractor or PT or acupuncture or something like that, like a lot of times we get those kind of like, kind of moments. It's like, yeah, that's great. But all that usually is just some sort of a reset. And if we then follow it up with some sort of reinforcement and then some sort of reloading, which is usually like putting weight or some sort of resistance to it into some pattern that wasn't working as well before, you know, that we're missing we're missing a huge opportunity for the body to relearn something, to try to get out of that compensatory pattern that it's been in that's probably causing some of those symptoms in the first place. So just something to think about. Let's try to find whatever that reset button is, whether it's a joint, whether it's a trigger point, whether it's like something that's inside the shoulder or the knee or the hip or whatever. There's all kinds of ways to like kind of unlock the nervous system. It just takes a thorough assessment to really figure out what's going on and what's driving it. So for me, that's the fun part of rehab, and same thing for all of our therapists here. So if that's something that you'd like our help with, then go ahead and reach out. That's what we're here for.